In men, we generally divide them first into erectile problems and problems with sperm production. Okay? Erectile problems form a small percentage where maybe there's no problem with the sperm being produced in the testicles, but the man is not able to have relations with the wife. So that way the sperm will not get where it's supposed to get, and then fertilization will not happen. Now, when we come to sperm production, it can be that either there's a problem with where the sperm is produced in the testicles, or it can be a blockage in the passage. Okay, because once the sperm is produced in the scrotum and the testicles, it has to travel through a very long pipe we call the vas deferens up to the to come on the outside through the male reproductive hormone organ. So if there's a blockage along that path, then there would be a problem. And some of these problems or blockage can be surgical. Someone could have undergone a surgical problem. Maybe they were being operated for something else and the tube blocks. It can be an injury during sports, falling, or whatever, but that's very rare. The commonest cause being inflammation, infection. Okay, so just like women, the way that you can have a blockage in the tubes, men can also get a blockage in their tube and the sperm will not come out. But that's not as a common problem as the problem in production. Okay, so sperm production can be affected, one, by hormones. Some people can have hormonal disorders. These are problems they are born with, so that they're not producing adequate hormones to tell their testes produce the sperm and to maintain the sperm production. Another common problem is genetic issues. So there's some some genetic disorders like Klinefelter syndrome, okay, where instead of the man having a normal composition of the chromosomes, then they have an abnormal chromosomal pattern, and that usually affects even the sperm production. There's also some other issues with the Y chromosome. Okay, remember the men have the XY chromosome. The Y chromosome is the one that is most involved in all these things for reproduction. There are some deletions. The Y chromosome has broken in some parts, and those deletions also affect production of sperm. So they could have either low sperm count or completely producing no sperm.